Sometimes getting and staying pregnant is difficult. It can take months, even years. But most women don't know that imbalances in their hormones may be the reason why. See, the menstrual cycle relies on a series of 4 main hormones: FSH, LH, estrogen, and progesterone. At the beginning of each cycle, FSH, or follicle-stimulating hormone, signals the ovaries to start follicle growth. Each follicle contains an egg. The growing follicle makes estrogen to prepare the uterus for pregnancy. Increased estrogen causes a sudden rise in LH, or luteinizing hormone. LH causes the follicle to rupture, releasing the egg to be fertilized. The follicle then releases the final hormone, progesterone. Progesterone builds the uterine wall, so it may house and protect the growing fetus. If the egg isn't fertilized, progesterone and estrogen levels decrease. Without progesterone, the uterine wall breaks down, menstrual bleeding begins, and the cycle starts all over. If the egg is fertilized, estrogen and progesterone levels remain high in order to support the growing fetus. Adequate progesterone levels are essential for both getting pregnant and supporting a healthy pregnancy. As you can see, each of the 4 hormones plays a very specific role. The most common cause of infertility is imbalances in one or more of these 4 hormones, which is why it's important to track your own hormone levels throughout your cycle. An ovulation predictor kit, OPK, can only be used to predict ovulation. In order to determine if your hormone levels are adequate to support a pregnancy, you need to test for estrogen and progesterone as well. MFB Fertility wants to provide women with affordable ways to test all hormones in their cycle at home, and that's why we were the first to develop a fast and easy-to-use home test to track progesterone. And we aren't stopping there. More tests are on the way. Visit mfbfertility.com to learn more and start tracking your cycle with confidence.